Thank you for joining us for this COVID-19 update. Today is Tuesday, February 15th, and this is Kathy Turner, Director of Communications for the Louisville Metro Department of Public Health and Wellness. Dr. Sarah Moyer, Director of the Department of Public Health and Wellness, is our host today. Joining her are Dr. Sarah Beth Hartledge, Associate Medical Director for the Department of Public Health and Wellness, Dr. Joseph Flynn, Chief Administrator, Norton Medical Group and Physician-in-Chief at Norton Cancer Institute, Dr. Christian Furman, Medical Director of the UofL Health Trager Institute, and Louisville residents Demetrius Booker and Jody Demling. I'd like to remind everyone to please mute your devices and place your questions in the chat addressed to everyone. Dr. Moyer, I'll now turn it over to you.
Thanks, Kathy. Good morning, everyone. Thank you for joining us. We are almost 2 years into the COVID-19 pandemic, and practically all of us have been impacted in some shape or form by the virus. Many of you have fallen ill, lost a loved one, or have had long-term complications from COVID. And even though case numbers are on the downward trend, the virus is still very much here and unfortunately will be for some time. People in the community are still being impacted by COVID-19. At this moment, hundreds of people are in Louisville hospitals fighting the virus, and many lives have been or will be forever impacted by COVID. Today, we are joined by 4 guests, 2 who will share their long-time battle with COVID-19 and how their lives have been changed. Demetrius Booker and Jody Demling both fought for their lives after contracting COVID. Thankfully, they pulled through, and today they are here to share their stories of survival. Both men are dealing with what's called long COVID, side effects that last long after recovering from the acute virus. Current data does show that 1 in 10, or possibly even more Americans are expected to experience longer-term health effects from COVID-19. And while our researchers are rapidly trying to learn more about it, there's still so much unknown about long COVID. Today, we're also hearing from Dr. Christian Furman. She is the medical director of the Trager Institute and helps to lead UofL Health's long hauler clinic. And then Dr. Joseph Flynn, Chief Administrative Officer of Norton Medical Group and Physician-in-Chief of the Norton Cancer Institute. When it became apparent that some patients who have not been hospitalized for COVID-19 were having long-lasting effects due to the virus, Dr. Flynn worked to establish a long-term care clinic. It's here that patients can come to get connected to a team of multiple disciplinary specialists to address ongoing health needs, which can range from lung and heart to neurologic and gastrointestinal issues. There are clinics for both adult and pediatric patients. So before we hear from 2 inspiring fathers and our guest physicians, we have Dr. Sarah Beth Hartledge, our Associate Medical Director, here to go over the latest COVID data. Dr. Hartledge.
Thanks, Dr. Moyer. So we'll just go through the data dashboard quickly. We have 5,800 new cases confirmed in the last 7 days. For an incidence rate of 108.3 cases per 100,000 of population. You can see from the curve that we are on the downslope of the Omicron wave. Their numbers are relatively flat from last week, so we saw a really rapid decline over the last few weeks and then a little bit flatter this week. We scroll down a little bit. Our vaccine numbers have also decreased and kind of flattened out here. So in terms of the folks seeking doses, so while 74.6% of Jefferson County residents have received at least 1 dose of vaccine, and that's great, we have only 44% that have received a booster. And if you do the math on that, since everyone age 5 and up is eligible for vaccination and everyone age 12 and up is eligible for a booster, we have over 200,000 Jefferson County residents who are booster eligible but have not received that dose yet. So as a reminder, the booster is critical for protection as we are on the downside of the Omicron wave, and we really just don't have any way of knowing what the next variant or the next wave might be. We'll scroll down. And as the Omicron wave has started to recede, we have seen decreases in our hospitalized patients as well. We have 310 patients currently admitted to area hospitals, and we have, of those, we have 55 who are in intensive care units and 35 on ventilators. The virus, as Dr. Moyer said, continues to have long-term implications for patients and their families. We did have 59 new recorded deaths from COVID last week, and their families, of course, are going to feel that loss forever. So it's a good reminder that even a so-called mild variant can have really important and long-lasting implications, even if a very small percentage of a very large number is still a big number. So we had, an incredible number of cases over the last few weeks or last couple of months, and in the Omicron surge. And thankfully, only a small percentage of those folks needed hospitalization, and a very small percentage of those folks passed away. But we have 59 families this week who are mourning that loss. So just another reminder that the virus is here, still here, and still impacting people every day. And Dr. Moore, I will pass it back to you. Thank you.
Thanks, Dr. Hartledge. I think we heard some disappointing news about the vaccine for 0 to 4. Do you mind updating us with that as well?
Yes, so we were excited to hear a couple weeks ago that Pfizer was preparing to submit the application for an EUA, the emergency use authorization that we have been giving COVID vaccines under. They were preparing to submit trial data for the next age group, which is 6 months to 4 years. So the under 5 set is not eligible for vaccination yet, and that was exciting to see that they were preparing to make that application. In the interim, Pfizer has now decided to withdraw that application to make sure that they have the strongest data possible and make sure that they are prepared with safety and efficacy data so that when the FDA reviews it, that they will have the best chance of a strong endorsement from the FDA and the CDC. So the trial is continuing. They are studying a 3-dose series in that age group. They had seen some early results with 2 doses that suggested they might not be getting quite the strong immune response in those younger kids. So they are studying a 3-dose series, and we hope to see that that data come through in the coming weeks. We're hearing probably about a month from now, perhaps longer. So for those with kids under 5, that's a disappointing news, but we are glad to see that they are focusing on safety and efficacy and making sure that they have the best possible product out there for when our kids are getting vaccinated.
Thank you. Gonna move on to our guests now. Demetrius, I know you guys, thank you for being here and willing to share your story. Demetrius, can you start and tell us a little bit about yourself and your overall health before the pandemic?
Okay. Well, thanks for having me. But well, let's see. Let's start off. I'm a graphic designer for the University of Louisville at JB Speed School of Engineering. And I was just gonna say, my overall health before all of COVID was actually really well. I mean, I worked out. Um, any, I really didn't have any kind of chronic illnesses. I mean, the only thing I had was probably asthma, but it wasn't even that bad. I never, I maybe had a rescue inhaler, but never touched it. Other than that, it was about it. I lived life just like everyone else, just, continued on day to day. And so,
How can you tell us about when you became ill with COVID-19? You spent 95 days in the hospital and a month in an induced coma. What do you remember from that time?
Oh man. Well, the week leading up to my date of actually being admitted into the hospital, uh, it was it was pretty crazy. It was because I was very fatigued. Um, it's like I just had no energy at all. I could barely breathe. That's where I was like, oh my gosh, I that's when the inhalers came out. Lost my sense of taste. Uh, and then not only that, the fever was just ridiculous. It was just like I could break it within an hour, it would come right back, and it was just constant. And then not only that, when it came Saturday, which was July 18th of 2020, that day I just was like, I was just like, I can't do anything. Yeah, I just started getting scared. So once then I called my sister and I said, "Hey, I'm scared." She just said, "Go to the emergency room." So I did. Once there, the nurse that was taking care of me at the time, she looked at me. She goes, started telling me, your symptoms. I started telling her. She goes, "All right, I'm just gonna give you a COVID test just to check." She goes, "But to be all the way honest, I don't need the result for this to come back." She goes, "I can tell you now, you have COVID." Um, I started to freak out a little bit because I was like, "Well, what does that mean?" Am I, am I gonna have to stay here in the hospital? Am I gonna have to, can I go home? And they're like, "No, we're gonna have to keep you overnight." And I was like, "Okay." Um, Other than that, I remember counting until about maybe 4 in the morning. After that, I don't remember a thing. So I was told, I guess, that that's when I was kind of sedated because shortly after that, that's when everything just started going, downhill because they basically said if I didn't come in then, they gave me like another 24 hours and I probably wouldn't be here. So after that, Uh, the next thing I know is I woke up in Lexington. I didn't even know I was in Lexington. Um, had a nurse come in and, in the full getup of, with the helmet and everything. And I was looking around. I was just like, not knowing, not seeing a familiar place that I was in at all. And then, as you know, she was just like, "Hello, Mr. Booker, how are you?" And I'm just wondering, like, first thing I was like, "Why can't I talk?" Because I was already traked. Not only that, I started looking into like why I have all these wires and needles and everything stuck into me. Uh, and only thing I could do was just mouth without any sound coming out. She just didn't ask me. She was just like, "Yeah, do you know what?" day and month it is. And no, she asked me what do I know what month it is. Only thing I said was July, and she said no, it's September. And I was just like shocked. I couldn't. It was just like it was so surreal because I was like, wait, what? Just to tell somebody, that so much time has passed, and then after that they kind of just started to tell me a little bit of everything, but yeah, other than that it was it was a long and just really tough journey during that time during my whole entire stay, um, because even after leave because even when I woke up from the coma and then finding out some of the things that I had been through, I still actually had COVID. Like I couldn't even leave Lexington. I was not allowed to see any family members. Yeah, no one was allowed to visit. Only way I could see people was through a monitor. I was basically placed in a bubble. After that,
That makes
after
sense.
that, I was there for just a couple more weeks until I was actually clear of COVID, and then I began my journey back to Louisville, where I was at Kindred Hospital. I was there for a while. Then after Kindred, then back to Baptist for rehab. So yes, it was definitely a long journey.
Sounds like a really long journey, but we're so glad you made it. How are you feeling today? What's life been like since you were released from the hospital and and treatment, what long-term effects have you been experiencing?
Well, to be all the way honest, I feel really good today. Um, Only long-term lasting effects I have to say right now is the breathing. The breathing is still difficult at times just because the damage that COVID did to my lungs. Because the thing about it was what was explained to me is that, the lungs can heal, but they do not regenerate. So whatever damage is done is done. So um, that's been the only hardest thing to deal with. But other than that, I've still been trying to get out to exercise. I have a 5-year-old little girl that definitely keeps me on my toes. So, taking care of her, that's like that right there is, exercise on its own, as you can imagine. But I'm trying to. Other than that, other than that, like I said, I do feel really good. I don't have like a negative or like bad feeling about anything about what happened to me. I always try to have a positive outlook on it, just because I'm just glad that I'm here. I feel blessed. So yeah.
We're glad you're here too, and my 5-year-old keeps me on my toes as well. So I know you're fully vaccinated and just recently got your booster last week. Can you tell us why you decided to get vaccinated?
Yes. Well, it was difficult at first. I mean, it wasn't difficult just to know the fact just to get vaccinated. That wasn't the thing. It was the one the one thing that kept just replaying over my head was basically when the doctors tell you, hey, if you get sick again like this, they're like, you're not gonna make it. You know, good thing the health I was in beforehand going in, because being on the ventilator, being on ECMO, everything, my body took a beating, from all of that stuff. So, and I mean, I lost a lot of weight. I've gained, I probably have to say I've gained most of it back like by now. But yeah, I probably lost, I think, about 60 or 70 pounds within that time frame. Um, but yeah, it was just it was just, oh man, just yeah, when they just tell you that, you're not gonna make it, if you get sick. I mean, it's basically a no-brainer to go get the vaccine.
Well, thank you for being willing to share your story and inspire others. I really appreciate it. So I'm going to move on to Jody now. We'd like to hear from you. And first question, can you share what life was like before you contracted COVID-19?
Yeah, it was. My life has always been hectic, but I've never had really any health, knock on wood, issues. No underlying conditions. I have a thyroid problem. I've had all my life. It's kind of a hereditary problem, and that was the only thing that I had, like, growing up, and even when I was kind of before COVID. I worked at the Courier Journal for 20 years. Hi, Debbie. I see you there. I know you're out there. And then in 2012, I left and went on my own to do some other work. I now work for 24/7 Sports, and I run a website that covers University of Louisville all athletics at the University of Louisville. I do and have done for a few years UofL basketball and football on the radio, on the radio network. I do some ACC network stuff to where I broadcast Louisville field hockey and baseball and basketball and other things. So just a lot of different things media wise, and a lot of different things in sports wise here. In town. Have been doing it all my life here in town, and that's kind of me in a nutshell. Sports and Louisville and the University of Louisville. But again, before all this happened, really no health issues at all. Just a thyroid condition. And like I said, I've had that since I was real young.
Well, tell us about when you first learned you had the virus and what happened afterwards.
Well, it's nothing's funny, obviously, with the virus, but I do have to laugh whenever you show those the charts and that. I'm at the very beginning, and most of the time now it doesn't even show me. We're so far away from there. I was actually at the ACC tournament in Greensboro doing radio. Well, we didn't do radio because the games got canceled, but I was there with the Louisville basketball team when everything got shut down on March 20th, in the college basketball world. And I was on the actual plane with the team. So we flew back on Friday morning. And then it was the next Wednesday, it was March 25th. I remember we had gone to visit my wife, my mom, my wife and two kids had gone to visit my mom. We were out in the driveway, we were already socially distancing and trying to do things, with what everybody was telling us kind of how to do things. And I came home and I felt chilled. I felt weird. And my wife immediately was like, you go in there, we're going out here, and we're going to quarantine from you just in case. And, for about 4 or 5 days, I guess, I had a fever. It was off and on. I was in contact with my doctors, and I wasn't showing all the symptoms at the time that were COVID. It was a lot of other things, and my doctor was like, I don't know that, at that time, I don't know that you have it. I don't know that we need to test you, kind of thing. And come around, it was like 7 days later. I think it was April 1st, on a Wednesday night, and I just felt terrible. And over the night, I remember sneezing at one point, and like it felt like every bone in my body was going to break. The next morning, it was a Thursday morning, my wife came to check on me in our room where I was quarantined, and I said, I can't catch my breath. I can't stop coughing, and I just feel terrible. So she said, okay, let's call the EMS. And she did. And when the EMS got here, they asked her, can he come down? And I'll never forget the moment I tried to get out of my bed, and I couldn't go any further. And so they got in their hazmat suits and came up and took me out. And when they took me out, I had a high fever, and my oxygen level was really, really low. And they were like, okay, we'll get you out of here, and they did. And I went to the hospital right then. I was on the ventilator the next morning, on a Friday morning. They had put me, they did some tests, or did everything, and had done the COVID test. And Friday morning, I didn't even know. I mean, I knew I had COVID at the time, but I didn't know for sure that the test had come back. And I don't think it did come back until after I was on the ventilator. But they put me on the ventilator on Friday morning. And the next thing I remember was the next Wednesday night, late Wednesday night. It was kind of stormy outside. I woke up. I was still on the ventilator. I was still strapped down and had it going. And then the next morning, on that Thursday morning, they took me off the ventilator, and then it was I guess a week and 2 days that I was in the hospital. So that's kind of my at least experience with it. So I initially showed symptoms on March 25th of 2020 and got out of the hospital on April 15th of 2020.
Wow, another long story there. How has COVID changed your life since April of 2020?
I'm very fortunate in the fact that my lungs are fine. I knock on wood every time I say that, just because I guess we never really know for sure down the road. But my breathing is fine. My lungs are fine. The couple times I have had a chest X-ray or they look, I always kind of to catch my breath for a second, say, please, just I just want that picture to show that it's fine, and I feel good in that capacity. It's crazy because I go about my everyday life. It was probably, I guess, July of 2020 when I really felt like I could, July or August of 2020 when I felt like I was getting back to myself. By the end of that year, I was doing pretty much everything that I could have done before. And now I do, my hectic lifestyle. I'm back at, all the work, all the things that I do with 2 kids and family and everybody, around me. So I'm back to that, but it's just, there's days when, like Christmas morning was a perfect example. I woke up Christmas morning and I just didn't feel right. And, I had a dizzy spell that morning about, 11 or 12 o'clock that afternoon. And that one only lasted for a few minutes. I have them every now and then. It's kind of lightheadedness. I kind of feel, a little dizzy, a little disoriented. And, everything checks out fine with me. My heart's checked out fine. My lungs have checked out fine. Everything, every doctor that I've gone to, it seems like I'm healthy. I'm good. And there's just little things that I don't feel all the time. And not, fortunately for me, I don't feel it as often as I did maybe a year ago. But there are just things that I can just tell I'm not myself. And again, it doesn't affect my everyday life, which is great for me, and it's great for my family and the people that are around me. But it's still there, and at this point, I'm very fortunate that I'm alive. Being that early in the process, when I had it, we didn't know as much. You guys didn't know as much of as what we do now, and that makes me feel even more fortunate than I would, I think, because of the fact of that I did have it so early, and there were so many people trying to figure out things that it was. A funny little aside story of mine is the doctor that I had, who was taking care of me when I got to the hospital, had just come back from a quarantine where she and her husband had COVID. And so they were like literally one of the very first cases in Louisville to have it. And, I know she had told me, she said, I spent my quarantine learning on what I was going to be treating when I went back. And, those kind of, that made me feel good. I don't know that I felt great at that time, but it did make me feel good. And so I live my life, and I haven't really, had a whole lot of things that have affected my day-to-day life, but I still feel it a lot.
I'm glad to hear you continue to feel better every day. I know it's been a long 2-year journey there. So you decided to get vaccinated as well. Can you tell us why?
Well, I think for me, it was a number of things. And for me, it was very easy. My wife and I, my wife and I both got vaccinated at the same time. Both of my kids have now been vaccinated. Actually, my daughter just got her booster recently. We've all got both shots and have been boosted. To me, it was pretty easy because I remember thinking back. I remember thinking back to the day when I couldn't get out of bed. When I couldn't. I had to have the EMS help me to get out of bed and help me to get on my road to getting better from having COVID. I also remember, just thinking about my family and close friends, and laying in the hospital that first day, and laying in the hospital for 12 hours when I was on a ventilator, and I was coming off the sedation, but yet I was still on the ventilator before they could take it out, and remembering those moments, those thoughts that I had in that time of, I don't want that to happen again. I don't want that to be me again. I don't want that to be someone in my family again. And really, it was a pretty easy decision for me when I think about those kind of things, and when I think about that. And I've done other media things. I've had other people ask me, hey, you were a bad case. Why did you do this? And I do tell them that. I mean, um, it's a story. Mine is a story that I do love to share, because it was so early, and because we didn't know a whole lot about the virus at the time, and I feel lucky that I'm alive right now. And if I could do anything to prevent from having to feel that, or having that opportunity to, for the virus to come back into my body again, then I'm going to do it.
Well, thank you. I know it must be difficult to relive those experiences, but we thank you both again for sharing what you've been through. It really serves as an important reminder that the virus is real and can have long-lasting impacts. If you don't mind staying on, I know the media might have a few questions for you at the end, but I'm going to turn it over to our physicians. First, Dr. Furman, she is the leader at UofL Health COVID Long Hauler Clinic. Dr. Furman, can you tell us about the Long Hauler Clinic and the work you do there?
Yes, thank you so much for having me, and it was great to hear your all stories. It does make it real, right? We began our clinic in October 2020, and it's a collaboration of UofL Physicians, UofL Health, Internal Medicine, UofL Trager Institute Optimal Aging Clinic, and the Christina Lee Brown Environment Institute. So we really see patients 18 and over, provide a comprehensive assessment. So we do this health risk assessment where we look at the psychological, the social determinants of health, the physical determinants of health, figure out how COVID has impacted you. It's so different for so many different people. So we do, it's a long assessment to really figure out all the different impacts that COVID's had. And then a lot of it just depends on the patient. There's so many different ways that people present, and treating, a lot of depression we're treating, a lot of functional decline we're treating, and referring people to whatever resources we can to help them and help the impact of this long COVID. So, we refer, sometimes it affects employment, sometimes it affects housing, the social connections, the ability to perform and function. So we address the whole comprehensive person, the physical, the psychosocial, the emotional, because it's just impacts, people have PTSD. I mean, there's all kinds of things that people have from this, and everybody's so unique. So we try to take a comprehensive approach.
I know you mentioned some. What are the long-lasting impacts that you are seeing? If you don't mind going into a little bit more detail about some of the biggest things you're seeing in your clinic.
A lot of people with the headaches, they have this fatigue, this just they can never just totally feel back to their prior functional status. A lot of depression, overall weakness. Sometimes it's pain, shortness of breath, a lot of that lung, the cough. Sometimes people still have a cough. Some people still have that loss of taste or loss of smell. The ringing in the ears, that constant ringing really, it just can drive people crazy. Brain fog, they're just, we've had some students that we've seen and they just can't perform as well in class, these college students, and just activity intolerance. They can't play with their 5-year-old as long as they used to be able to play with their 5-year-old. Loss of appetite, people have lost weight, have nausea. Sometimes they have high blood pressure, sometimes they have low blood pressure, sometimes it affects their other medical conditions like their diabetes. Their diabetes is more out of control. Hives, rashes, skin issues, hair loss. It's so individualized for each individual patient, but what we found a lot is they've gone to their primary care doctor, and it just depends on the doctors. I'm glad you're having this so people know more about it, but some of the doctors don't even really know anything about it. And they're like, oh, you're fine. And they dismiss it. And that's what really is so hard for the patient, because it's like, no, it's real. They really do have these issues, And so a lot of it's just validating that, yes, this is real. This is true. I think the more having this clinic is helpful, because the more we see patients over and over again, the same type of patients, we have a better feel for what to do. I think some primary care providers, it's just like, this is the one patient they've ever seen and they don't really know what to do. So we're just here as a resource, and people can refer to us to help kind of work through this. It's really, really individualized. It's not a cookie cutter approach. We prescribe a lot of antidepressants, a lot of referrals to Fraser Rehab. But sometimes, we have to send someone to a pulmonologist or send someone to a heart doctor. So it really is very individualized.
No, that's great. And I know that's one of the big things about long hauler is, one, trying to learn more about it, and then two, trying to make sure people are aware, even providers are educated about what's happening. What are some, you mentioned some, but what are some treatments that you're using in patients that have been helpful?
Yes. And so one big thing too is here at the Trager Institute Optimal Aging Clinic, we have behavioral health therapists that are employed here, that work here. And so a lot of it is referral to counseling, because you just need to really kind of work through all these emotions, all these thoughts. People aren't sleeping well, and how to have a good night's sleep, and how to use like meditation and mindfulness to help with the pain and the symptoms. So a lot of that is referral to behavioral health. There's not like, when we're seeing these patients, they're further out, like a month out or so. But, so right away, people, seeing the primary care provider or using like the monoclonal antibody infusions and things. So we're not really prescribing anything like that because our patients are like, a month or so out to really be considered a long hauler. So there's not any specific treatment for long haulers. I mean, that's what we'd love to get to a point. And I think that's why, we are doing research at the university to try to, track this. And there's other long hauler clinics around the country that we can all collaborate, put our heads together. So there's not really any specific treatment. It's treating the symptoms. So if you're short of breath, like you said, sometimes the inhalers, if you're having functional issues and not able to move, doing the physical therapy, occupational therapy. If you're having that brain fog, we do have a neuropsychiatrist that we work with, and sometimes just doing the memory assessments to say, yeah, and to be able to track people over time. Okay, your memory is impacted, but over time, okay, it's getting better, and we can have actual assessments to see it getting better or not getting better, because then it affects your job. It affects a lot of things. So sometimes we have social workers that work here, so we have to write letters, to the employers, and so a lot of the treatment is just addressing all these individual needs, but we do it as a comprehensive approach. So, and sometimes just having a name for it is a treatment in of itself, because people need to know that this is what it is. And some people, really just do get better with time and with specific treatment, like, the inhalers or antidepressants or, physical therapy, the exercise, the counseling. But some people, we don't know yet. It's only been 2 years, but maybe, in 5 years they'll get better. So, but most people are getting better over time. And it's funny because sometimes people have an appointment and then they don't come because I think they're better. They're like fine, and they don't think they need to come anymore. So that's always a good sign, when people don't feel like they even need to come.
No, that's always a great sign when people get better with just time. So how many patients are you guys currently seeing in the clinic? And if others out there in the community right now are dealing with long-term effects from COVID, how can they get help?
Yes. So we have it set up. We have 2 different providers, and both of them are internal medicine doctors. They can see patients, 18 over. So we're seeing on average about 5 patients a month. We have the capacity to see more. So definitely we have openings, because I think it is true that people sometimes just don't show up, they get better. So they can call our clinic. It's 588-4340 is the number. We have a website. It's we're located in Nulu on Market Street. So we have like free parking downtown in the back, which makes it nice for people. And yeah, that's the flyer. So you can there's the website on there, and you can make an appointment through the web or just call our clinic. And we'd be happy to see people. It's all through UofL Health. So we use Epic, and we can communicate. Even these examples today, people have been through so many different hospitals sometimes by the time they get to us, so we can, track down all the information and make referrals.
Well, thank you, Dr. Furman. If you could stick with us till the end in case there are questions, I really appreciate it. Thank you for sharing your expertise.
You're welcome.
Dr. Flynn. So we move on to Dr. Flynn now. Dr. Flynn, can you tell us more about Norton's approach to helping patients with long haul COVID?
Sure, and I think Dr. Furman did a nice job of explaining really a lot of the issues we're all facing. We started our clinic actually in September of 2020, and we've seen about 1,000 patients thus far since the onset. And again, as was pointed out, and we heard from Mr. Booker and Mr. Demling, a lot of this, there's differences and there's similarities, but as with probably most of the programs in the country, it really takes a multidisciplinary approach, as was pointed out. Since you see so many different scenarios and symptoms people present with, it may be just a little bit of brain fog, and how do you really quantify that? I think the part that most patients find frustrating is that they'll come in with symptoms and something they feel and something they, as Mr. Demling said, he feels not right at times. Well, there's oftentimes you can't directly describe from either a lab standpoint or otherwise what's causing that, and that is a frustrating thing. So we find that a multidisciplinary approach. We have a memory clinic that we refer to, certainly behavioral health. 1 in 3 patients will have anxiety, general anxiety disorder. 1 in 5 will have depression, and that's a major component. And Dr. Furman talked about a PTSD-like syndrome, and I think that is what we see. Important thing to really point out for people is we've heard 2 poignant cases when people are very, very sick, but you don't have to be very sick with COVID to have long-term COVID symptoms. And that's something that we're seeing quite frequently, and it doesn't really portend to necessarily how sick they were in the acute phase. We've seen everything from people that were marathoners who can't blow out a birthday candle to people that, as was pointed out, were students and high functioning and really just have a overarching brain fog, headaches, fatigue. Fatigue is very common. Obviously, with the early part of COVID, it was so specifically around the lungs and cardiac that you still see a lot of shortness of breath and long-term issues. And that there's a lot of theories as to what causes this. We're starting to see things, some literature around long-term autoantibodies, similar to what you see in other autoimmune disorders that people can have. So they'll have long-term symptoms. In the acute phase, the inflammation that we saw with cytokines and that type of causing long-term injury to cells. So what we've really tried to focus around is really where that patient is when they come in. As Dr. Furman pointed out, many do come in and they're somewhat frustrated because there wasn't a lot of information in the early going. And as we've continued to learn more and more, it takes time. And that's the part as we go. We've certainly, in the many interactions we have with patients, we've learned a lot and been able to, I think, help a large number of people. One of the things I think that's important for people to understand, and you asked both our guests around vaccination, we do know that the unvaccinated has about a threefold increased chance of having long COVID syndrome, and that's an important thing to understand. And there's a lot of potential reasons for that, but I think it's just another reason as to why we should be vaccinated.
No, a very good point there. So not only do they have a greater chance of getting long hauler, they also have a greater chance of getting infected with COVID. And we know COVID prevention is the best way to prevent long haul in the first place. Right. Also, I know Norton set up a pediatric clinic. Is that relatively new? And are you seeing many kids with COVID long haul?
Yeah, so we have the adults where we started. Obviously, in the early going, that was the predominant population. And as we saw when MIS-C started happening, which is obviously an inflammatory syndrome, engaging with the pediatric population, fortunately, we haven't seen as much, and mainly because they just haven't been impacted as profoundly. But we are seeing those patients that have had cytokine and inflammatory injury requiring some added attention. But just like in the adult world, we're really focusing around the multidisciplinary approach to the care, because this is truly, as we heard from both Mr. Demling and Mr. Booker, around the fear people have that is a profound trauma. And in having been in the Army myself for many years during wars, that PTSD has long-lasting effects, and that is part of it for folks. And it's I imagine and unfortunately I haven't had to experience being intubated, but that waking up with inability to speak or to be intubated, it's got to have an impact. So with the kids and adults, we've really focused around a multidisciplinary approach.
Thank you. I just really want to emphasize one of the points you made in the beginning, where you said that you can have mild COVID, but then have severe long haul COVID. We really don't know yet. Like, the research is still happening on what caused it. And so just want to emphasize that the best prevention of COVID long haul continues to be preventing COVID in the first place. So please, everyone, continue all your layered protection measures for the next month. Vaccination, get your booster, keep up some social distancing and masking, testing, hand washing, and especially staying home when you are sick. So thank you, Dr. Flynn, and all of our guests for joining us today. I learned a lot and hope everyone else did as well. So I'm going to hand it over to Kathy for questions from the media. Kathy.
Okay, thank you. The first question is from Sarah Ladd. Are the flattening cases indication of a plateau, or do you believe the declines will continue? Dr. Hartledge, can you address that?
Sure. So Sarah, I think that we are at a little bit of a plateau here, but we need to see a couple more weeks of data to know exactly what that trend is. We saw a very precipitous drop in cases over the 3 weeks or so prior to last week. It may be that we have the BA2 subvariant circulating. but we don't know that for sure. So we'll need to see a couple more weeks of data to see for sure whether we're plateauing or declining. I will say that with every successive wave, the baseline has moved upward. So we never get all the way back to zero. So when we had the Delta wave, when it was over, we never got as low as we were before Delta. And I would expect that trend to continue for Omicron and subsequent variants as well.
Thank you. Also, Dr. Hartledge, this is a question from Tara Bassett. Can you elaborate about the chance of true reinfection with Omicron as opposed to positive PCR results, even weeks after initial infection?
Okay, so a positive PCR result generally should be considered a true positive, even if a home test or an antigen test was negative. I know we talked a lot during the Omicron wave about how the home tests were less sensitive, but remain specific. So if you tested positive, it was a true positive, but a negative might not be a true negative. In the setting of PCR tests, if you have a positive PCR test and an infection followed by recovery and a negative PCR test, then a subsequent positive would generally be considered a new reinfection. In the past, we have said that any positive test within 90 days of your initial positive would not be considered a true case, a new infection. And so we generally advise people not to get tested immediately after a previous infection. But with that said, the Omicron variant, we have seen it's called short interval reinfection, meaning 45 days or somewhere between 45 and 90 days. So it can happen anecdotally. We are seeing that, but there's no specific numbers on that at this point.
Okay, thank you. Another question from Sarah Ladd is, Dr. Moyer or Dr. Hartledge, Dr. Stack and Governor Beshear said last night they believe Kentucky should be out of the red by March 14th. Based on what we are seeing in the state's biggest city, are we on track for that? Dr. Moyer, do you want to address that?
Sure. So cases are trending down and hopeful that it will continue. As Dr. Hartledge always says, I don't have the magic crystal ball. So hopefully the Omicron BA2 will not take hold and increase cases back up. But if that trend continues, we tend to be a week ahead the rest of the state. So expect to hopefully be out of the red before the rest of the state.
Okay, this question is from Gabrielle. Actually, she has two questions. In regards to the new antibody treatment approved by the FDA, is that in place of the two taking out of the mix for now due to them not working with Omicron? Do you have the treatment already, or when do you expect to receive it? I think I'd like to address that question to Dr. Furman and Dr. Flynn, who are actually providing treatments in the hospital. Could either of you weigh in?
Yeah, it is true. Like during Delta, the monoclonal antibody infusion was like that bam bam, or but now with the Omicron variant, we're not using those antibody infusions. So it's Dr. Flynn, can you say it? It's S. It starts with an S.
Isotrovimab. Yeah.
Yes, thank you. So that's what we're using, but I think there was not a lot of it throughout the whole state. And I do a lot of nursing home work and trying to get our nursing home patients. We are contracting with pharmacies, and the pharmacies are able to get it to us, and it's been a whole thing. But we're finding that there is more supply of that now. So that is the monoclonal antibody infusion that we're using now. I don't know, anything else you want to add,
The
Dr. Flynn?
bebtelovimab is what I think she's referring to. We just got an EUA approval. A couple things on bebtelovimab. It does appear to be active from the BLAZE-4 study, active in the Omicron variant. I'm not sure they had BA2 in that study or not. So right now we're supposed to start seeing it in the state hopefully this week. It really comes down to, as Dr. Furman said, how many doses you get, and as we're kind of we're seeing the numbers drop down. The one advantage of the bebtelovimab, it's a quick injection. It's intravenous injection over 30 seconds as opposed to the others that were an infusion. So I think it's going to add some convenience as well. So that will be starting up here shortly. So
And
we'll
there
have
are-
sotrovimab for antibody and bebtelovimab and then Paxlovid and the molnupiravir from antivirals.
There is more treatment now, which is good. I mean, there are even the pills, so, but everything has a side effect. So you have to look at the patient, see what the medicines there are, what the kidney function is, what their liver function is. So that's why I've had some patients like, well, why can't I get that? I've heard so-and-so got that, and it's like, well, it's just so individualized. It's not one size fits all.
Thank you both. And Gabrielle, I think we already answered your second question. It was the question that Sarah Ladd also asked, but if we didn't, just put another
Add
question
a little
in the
bit
chat.
more to that,
Oh,
Kathy.
okay.
Just a reminder that the CDC recommends universal masking when your community is in the orange or red. And so recommend all workplaces and schools keep that universal masking on until we do get into the yellow, and then can reevaluate then what's going on and what the new variant might be.
Thanks, Dr. Moyer. We also had a question from Facebook. Dr. Hartledge, can testing differentiate between flu and COVID?
Yes, absolutely. Even the rapid tests that are done at home or in a doctor's office can differentiate between, they're specific for the virus in question. So they can test you for flu, they can test you for COVID. Kids get also tested for RSV. There are a number of other respiratory viruses out there, but the tests are specific for the virus in question. So yes, absolutely, the test can tell the difference.
And we were doing a lot of strep testing at the same time with this Omicron. It was like a lot of upper respiratory. So people would come back strep positive and COVID positive sometimes. And yeah, we've been testing for like both COVID and flu at the same time.
Okay, thank you. Thank you both. Dr. Furman, and I'll also include Dr. Flynn, this question from Paul Miles, WHAS Radio. Are you seeing any difference in long haul symptoms based on the variants, Delta and Omicron? Is there any difference in symptoms? Dr. Furman, do you want to start?
Omicron is so relatively new. I mean, like December, January. So then the long haulers is like a month after that. So, it would just be kind of like now that we'd be seeing long haulers from Omicron. So we really haven't noticed any difference right now, but maybe it's too soon to tell. I don't know. What about you, Dr. Flynn?
Yeah, I mean, your point's exactly right. A couple things that, here's the misnomer I think people need to understand, that when we talk about the Omicron variant, everyone thinks it's the mild form. And if you look at the vast number of patients, it is more mild in general, although there's still hundreds of patients that have been admitted with severe disease and have still died, as Dr. Hartledge pointed out at the beginning of the discussion. So if you look at some of the early data, it looks like 30% of people with Omicron can get long COVID syndrome. And that's, as Dr. Furman points out, we're still learning as we go. My guess is, though, you are going to see that as people move forward and realize that this either chronic congestion or chronic other symptoms were related to a COVID infection.
Right. And then I think somebody asked that in the chat, like they didn't even know they had COVID. They thought it was just an upper respiratory thing. And where it says, and now they're having these long hauler kind of symptoms, and they don't even realize it's related to COVID. Right. And now it's just going to be such a huge number of these people because there's so many people had Omicron. So I think we're in for it coming up in the future.
Okay, thank you. This question is for Jamie. Lawmakers are talking about a bill that would ban mask mandates in schools and daycares. What does that mean for COVID numbers in children? So, Dr. Moyer and Dr. Hartledge, I know you both have younger children. Dr. Moyer, would you like to answer?
I mean, we have lots of evidence that show that masks, especially surgical or stronger masks, work in preventing the spread of COVID. So if our kids in schools, and I think that bill includes university and any property owned by a university, so it would be the entire UofL hospital would not be allowed to have masks. We could see a lot more infection in our community.
Thank you. Our last question is from April Rickert with WFPL. She's asking, so is it possible that people who were positive, COVID positive, but asymptomatic and never tested could have long haul symptoms and not know they're associated with COVID. Dr. Flynn, Dr. Furman?
Yeah, I think Dr. Furman touched on this, but yeah, so I think many people right now, it's called surveillance bias. So the numbers, and Dr. Harledge talked about this up front, that we don't know, we don't know. And there's a lot of people that have had COVID that didn't go in and get tested. That just didn't feel sick enough to want to go in to be seen. And there's a lot of those patients out there. So whatever numbers you've seen as far as the total number of patients with COVID, that is a fraction of the number of people who've really been infected. Just think back for a moment of it was in South Africa, and then it was widespread throughout the United States in a matter of weeks. And there's many people that never seek attention. So yeah, those people that were never formally tested can most assuredly get long COVID syndrome.
And I think if this group here, the media and everybody could really I think we need to get the message out to the primary care providers that they need to be prepared for this, because I think it's going to really, our healthcare system has been stressed from the beginning. And I think this is going to stress the healthcare system. More patients are coming in just complaining of stuff they don't know what it is. And I think if they could connect it to COVID, help everybody at least name it, not think they're going crazy, these patients, like they just don't know what's wrong with them. And a lot of times it is COVID, they just didn't realize it.
Thank you, Dr. Moyer. That was our last question. Any closing comments?
No, I just really appreciate all the expertise and discussion today. I think it's something we haven't talked enough about, is the long haul symptoms and what's to come for our community even after we pass the initial surges of acute COVID infection. So thank you for being here and sharing your expertise, and stay safe, everyone.